Hi, everyone. Thank you so much for coming. We're super grateful to have you all here. We're the indoor air quality team, and we're super excited to share the work that we've done this semester for this team. I'm Savannah, and I worked with Aditya, Andrew, Carlane, and Andrew. And Trishni. Oh, sorry, I said Andrew twice. So moving on, I have a quick agenda for what we're going to be talking about today. First, we're going to talk about the problem space and some of the problems that Stockton has and why it's in the position that it's in today. Our goals, which are distribute, update, and educate, and then our deliverables associated with each of those, which are our matching quiz, our outreach with Conway Homes, and our educational flyers, and then wrapping up with a 5-year plan and some next steps for Stockton.
So, hi guys. So as we know, with the photo above, we know that Stockton is an asthma capital. It's ranked one of the most suffering communities in the US, and an estimated 101 per 10,000 people visit the ER due to an asthma attack. So on the photo on the right, we see that this is the AB 617 border, as you know, and highlighted in the green are the Box Track community, Little Manila, Conway, and Charter Way as well. So we see that all the communities are marked darker in blue, which have more asthma rates compared to those are above the border. So as you see outside the border, it's like less blue.
All right, so a lot of this is due to the outdoor air pollution, like through factories and freeways that we've seen. But many people don't realize that this outdoor air pollution can actually travel inside and pose a threat to you inside. So indoor air pollution includes those outdoor pollutants, but it can originate inside from using cleaning chemicals, smoking indoors, and having mold in the house. And these lead to the problems like Carlene talked about, like asthma. And this is pretty important because we spend 90% of our time indoors. So that brings us to our solution, which is to distribute, update, and educate.
So first looking at distribution of free and effective air purifiers. The first step is just figuring out where we should begin to allocate these resources. And this is just one example of how we can begin to do this. This graph kind of just map shows on the red dots medical facilities, purple is schools, and they're just within 500 feet of major freeways and streets. And so just looking at like, okay, close proximity to pollutant sources could be an indicator of where we could focus in on. Also to prioritizing asthma prone or old and young kind of vulnerable groups, and also disadvantaged homes like low income. Also to, as we begin to distribute and hold events like this, where we had Edison High School and Southwest Stockton, where we helped to distribute DIY air purifiers, about 120 we built, and also along with some Levoit minis, which we'll discuss how we selected those.
So to select the Levoit Mini as the right purifier to distribute on Earth Day, we carried out a cost-benefit analysis and determined the amount of coverage that multiple purifiers could get while still being effective. So that brought us to the Levoit Core Mini as the one to go for. And we recommend that in future initiatives where the city gives out purifiers, the Levoit Core Mini would be a good jumping off point for that.
Yeah, so in spite of the Levoit Core Mini, sometimes you need a more initiative or a better push to get that. So we've decided to make the matching quiz, which with a simple press of a button while also writing down your email, you get to choose whether or not you get to write down whether you live in the border and what kind of behavior that you do in your home. So that would be whether smoking or how many rooms are in your house. So then after that, you get your matching quiz score, and either you get the Levoit Core Mini or you get a tutorial on how to build your own air filter.
Okay, next looking at how to begin updating fixed systems and homes with MERV 13. Once again, sort of looking at how we can begin distributing these resources. And for this, this map here is displaying ages of homes within Stockton. Kind of the reddish and purple is with the more older homes, and with older homes, will tend to have higher leakage values, and so there's a greater exchange of outdoor air pollutants. reaching inside despite if we ask them to close their windows and doors. Along with this too is, looking at this next map, is that it wasn't until like 1987 that we began to have strict regulations of MERV was like enacted within the HVAC system, and so houses built before then are less likely to have been held up to this MERV standard. So maybe are more likely to have less updated HVAC systems, which we could then begin to look into helping them with.
So one of our biggest deliverables this semester was working on an outreach program with Conway Homes, which is a low-income housing complex in South Stockton. So it's in part of the region that's highly affected by poor air quality. And that was a really big channel for us to kind of make a difference in indoor air quality, because there's almost 1,000 units there, or almost 1,000 families that live in Conway Homes. So we reached out to them and we created a slide deck to kind of persuade them into updating what they currently have MERV 8, and we want to persuade them to update to MERV 13, because that's the highest grade that you can get of MERV filters before it gets into a more industrial grade MERV filter. So in our slide deck, we had a 3-pronged approach to persuading them. And the first thing we did was we talked about PM 2.5 and the health implications of increased PM 2.5 levels. So as we know, research has indicated that health complications increase as PM 2.5 levels increase. The second thing we did was a comparison of MERV 8 versus MERV 13. And we found that MERV 8 filters trap about 20% of PM 2.5 particles, whereas MERV 13 filters have the potential to trap 85% of PM 2.5 particles. So a pretty big difference there. And the last thing we did was a cost analysis where we identified the cost to continue with MERV 8 filters, which they have to do at least once per year, and then the cost to upgrade to MERV 13 for 1,000 units in Conway Homes. And we found that the additional cost would be just under $1,000 at $992 for the investment in health of Conway Homes tenants.
Looking at education, beginning to educate the community how to track and maintain their indoor air quality. Once again, the Earth Day event was a good way of doing this, and I think one of the key takeaways for me from this event was being able to directly interact with the community, and also just dispelling any misconceptions they had. For example, there were some residents who thought like to use an air purifier as a fan, and so just being like, okay, no, this is not. This is for. Also too, for the event, we made some simple flyers, just trying to keep things simple, accessible. And so for this, we recommended the RAN Valley Air app, which is kind of just give them a notification of when their air quality was bad and when they should turn their air purifier on. And then also just directing them to other resources, and as well as translating it into Spanish to make it more accessible.
So in order to reach our goal of permanent clean air in Stockton through our 3-prong approach of distributing, upgrading, and educating the AB 617 region, we developed a program to train community residents in reading, understanding, and analyzing air quality monitoring data, and then developing actionable next steps based on what they find and sharing their findings with their neighbors. And some recommended next steps could be things we talked about, like upgrading ventilation systems and identifying new locations for more air quality monitors. This will help build trust within the community and give the community a long-term air quality database with which to measure their progress with. And we hope that once we've empowered these communities with education, they can advocate for themselves and their health in reaching our goal of permanent clean air in the AB 617 region.
So our plan for Stockton can be pretty easily implemented in other cities, such as Sac, Fresno, and Bakersfield. And this is a map of cities with the highest PM 2.5 levels. And no matter what city that we want to take action in, we want to be transparent with the community and involve community leaders every step of the way. And that is our plan to improve indoor air quality in Stockton. Thank you.